So I'm very excited to introduce Leah Wohlgemuth, Heather Burgess and Geordie Woods. Today, they will be presenting their talk entitled Ascend COVID-19 Response, Wrap Up and Lessons Learned. So when the COVID-19 pandemic broke, the World Health Organization advised that NTD activities should be postponed until further notice. The Foreign Commonwealth and Development Office, FCDO, offered the organizations it works with the chance to adapt their programs to respond to the pandemic. UK Aid's Ascend West and Central Africa program embraced the opportunity to use their expertise to stop coronavirus spreading in program countries. The program focused on two main areas: training, deploying and supporting contact tracers, and raising awareness of COVID-19, how it spreads, and how transmission can be prevented by changing behaviors. So I will now pass things over to our presenters to officially kick things off.
All right. I'm going to go in full presenter mode and turn off the video so it's easier on bandwidth, but let me know, Heather, if there's any issues with the screen, because it's hard to see the chat when I have it shared.
No, at the moment it's only showing the window small. Oh, there you go. Now it's not. All right, so as Alyssa said, thanks everyone for joining. Obviously we're presenting in a small group, but so many more people were involved in the response, too many to name. But we did want to shout out to Bex Hill for being the team lead on this particular project. But we'll go through a little bit more on exactly who is involved. So in April 2020, whilst the Ascend West and Central Africa Programme NTD activities were largely on pause due to COVID, we began working at pace with Ministries of Health and national COVID-19 task forces to try and understand the gaps in national COVID responses of the Ascend countries. So within this information, we then worked out where the Ascend consortium had kind of expertise or the ability to try and plug some of these gaps. The COVID-19 Flex was a huge adjustment for the team, working with different partners in a short time frame and a completely new area of work. It required substantial temporary shifts in program structure, systems and processes to allow the COVID-19 Flex to function whilst maintaining the while maintaining the support required for the NTDs in the background. So needless to say, none of it would have been possible without the incredible effort of our in-country teams, who took on a huge amount of work for the COVID Flex, whilst also working out how to safely restart NTD activities through the RAMA process. So although the challenge of such a shift cannot be underestimated, we're proud and inspired to have played a part in the COVID-19 response in several countries. It was FCDO's primary route of support for the national response. And this demonstrates the team agility in the most challenging of times. So yeah, we can move on to the next slide. So this is a little bit of the time scale. So following an intensive period of coordination with governments, by mid-June, concept notes for 11 countries had been approved for implementation and activities were underway. So with the support of the Ascend partner M&C Saatchi World Services, 10 countries received expert creative support in the development and rollout of engaging behaviour change communication campaigns focused on COVID-19 response and mitigation. And next slide. So in addition to the behaviour change campaign that Leah will go into more detail on, 10 countries requested targeted support with community level sensitisation, training, surveillance, and or the provision of hand washing and hygiene supplies in relation to COVID-19. Many countries utilised our existing community volunteers, or CDDs, to help disseminate COVID prevention messages, either door to door or using other methods that would normally be used for NTD sensitisation. I won't go through all of the different examples here on the screen, but on to the next, yeah. So in Guinea-Bissau, Liberia and Sierra Leone, We also helped in different types of training, such as entering COVID-19 data into the HMIS system and contact tracing. A particularly innovative part of the response was in Guinea, where we were able to help create a form on the National Health Security Agency website, where members of the public or local governments could report rumours that they'd heard about COVID. And this allowed the Ministry of Health to respond quickly to misinformation and really specific rumours, which we all know has been a key issue associated with COVID responses worldwide. Next slide. Our response was able to be implemented so quickly thanks to the support of the community volunteers and health workers who already had existing relationships with our NTD programs. And obviously our in-country offices and all of their existing relationships with ministries of health and local communities. So again, I won't read this out, but we've got loads of fantastic quotes from our community volunteers, including Uma in Nigeria. So to summarise, the community interventions, so that's not the mass media campaigns, were done in 10 countries. We trained over 13,000 people, and we've estimated that over 23 million people would have been reached by these interventions.
Thanks, Heather. I'm just popping off mute and then sharing my screen again. So Heather has highlighted the non-behavior change or mass communication activities that we've done under Ascend, and now Geordie and I will take you through some of the behavior change and mass media campaign activities that we took. So starting with this slide, which I recognize is not very easy to read and maybe a bit overwhelming, but the idea behind this is just to show you how many different multimedia assets that were developed, the various languages that were done, and the countries in which they span. So the idea here is just to see the huge amounts of assets that were designed in conjunction with our country teams, ministries of health, and MNC Saatchi, and how we were able to really translate these into a lot of local languages. So the other piece to note about the COVID response is that we worked with Andrea in the social inclusion team to really focus on how we could make our materials and messages more accessible. And that was a big part of the response, but I just wanted to say that today we're going to focus on the overall COVID response, and then there'll be a forthcoming lunchtime talk, I believe, at the end of March, where we dig into that in more detail. So I just wanted to highlight that, thank Andrea for his support, and let you know that more will be forthcoming on that. So here's just, again, a big overview, and similarly to how Heather summarized, we did this mass media campaign across 10 countries. We translated materials into over 49 languages, and we reached over 130 million people with the mass communication campaign. So as you can see just from the numbers alone, it was a huge response, and this all happened within 6 months. So a very big feat indeed. So with that overview as a background, I wanted to take a step back a little bit and walk you all through the creative process and how we got to all these assets, which we will be showing you some a little bit later. So really the kind of starting point in working with MNC Saatchi, we wanted to make sure that this campaign across all the countries elicited an emotional response, was simple, and was single-minded. So those three tenets really served as the basis for our response and helped us move quickly, having these three pillars in the back of our mind. So obviously during a pandemic, I think we've all felt this way before, is that in a crisis, people struggle to absorb information. There's so much information coming in. Not only is there an influx of information, but there's conflicting information, there's changing information, and there's so much to do. People often feel overwhelmed. So how do we as communication experts and NTD programs work to help people through this situation and this feeling? One thing it's good to focus on is what rarely works. So an idea of having a very jam-packed poster saying to do all of these things. So, I mean, you look at this poster, someone may focus on the calendar and the quarantining, someone else may try and see the different symptoms, but I would think that most people feel there's a lot of information and a lot of messages in this poster, and perhaps this isn't the approach to take, because what are you really trying to get people to take away, and what is the main thing for people to do? Again, this can contribute to that feeling of overwhelmed or just inundated with information. So what we tried to do as part of the response was making sure that we framed the what with the why. So it's not only to say wear a mask or wash your hands, but it's to explain why you should do that. You know, wear a mask to keep your family safe, or wash your hands to avoid spreading COVID-19. So again, that key thing is not just saying do this or do that, but providing an emotional reason linked to that so that we can make sure people are changing their behaviors. So with those that background in mind, we developed 3 strategic territories, which we could also refer to as themes going forward. But those are what were the main tenets of the communication strategy in each country. So you'll see here that the structure for our campaign included this overarching territory or theme, and then these key behaviors within it. So again, you'll see here we've highlighted the simple and single-minded message for each behavior. So I'll explain a little bit more detail what the themes are and some of the behaviors, but just so again you understand, this is the overarching strategy that we had, and this framed the development of all the communication materials that we implemented. So there were 3 different themes or territories that were decided upon with MNC Saatchi and the countries, and we only have a short amount of time today, so these themes were all developed based on a lot of research and identifying what some of the challenges were in all of these countries, and we distilled the 3 themes to go across all of the countries, and we could discuss more in depth that process as well. But here I'm just going to highlight the 3 themes that we came up with, and you'll see underneath the theme the countries in which these themes were deployed. So the first theme that we had was trust or truth. And again, this whole idea that misinformation and mistrust was rampant as part of the pandemic. It still remains an issue, especially as we move into vaccine deployment. And what we wanted to do is basically say that truth is our defense against the virus. So we need to make sure we're sharing the right information, the right people are sharing it, and that we have trusted messengers. I think we can all agree that who delivers the message, and if we believe that person, is a huge part in uptake of communication and behavior. So that was one route that we took in Burkina Faso and Nigeria. The other territory or theme was around protection. So some people maybe felt like the virus wasn't applicable to them, or it wasn't, although this is a global pandemic, some people still didn't really feel that they were at risk, and perhaps they didn't need to do anything to prevent the spread. So identifying this idea of protection and creating a sense of collective responsibility. So I know, in the UK, there's a lot of campaigning around protect the NHS. So that's a similar theme that you can see coming out there, but identifying that by following the health advice or the messages that you're protecting yourself, you're protecting your family and your community and your country. So again, this bigger sense of self. And you'll see that was the theme that was used in Chad, Guinea, DRC, and Liberia. And then finally is this idea of playing your part. So similar to protection in that it's just the idea of we all have a role to play, but showing that we can lead by example, and that we have a role to stop COVID-19. So in Ghana, for example, the Ministry of Health identified that there was a gap in messaging around children, and we helped plug that gap by identifying that children have a role to play as well in this pandemic, and that children can, stay home and not be playing with their friends, etc. And that is another way that we communicated the messages in Benin, Ghana, and Sierra Leone. So those are the 3 territories, again, that we used across the campaign, and we'd be happy to, with any of this, provide more detail and information on any of the specific countries, but just wanted to give you a quick highlight of how we approached it. So now with that being said, I'm going to quickly take us through just an example of how this all played out in Nigeria. And of course, a big thank you to the Nigeria country office for being so amazing in this process and really stepping up. We had a lot of mass media developed in Nigeria. There was coordination amongst 3 states, and the team, as expected, rose to the challenge and really did a great job. So as Heather said, presenting on behalf of a large group of people, and a special thank you to the whole Nigeria team that I hope are on this call. So starting out was identifying some of the core challenges in Nigeria, and we focused in Nigeria on Kano, Kaduna, and Sokoto in northern Nigeria. So obviously, this isn't to be blanketed across all of Nigeria, and this was specific for challenges for these 3 states. There was a lot of misinformation going around in Nigeria, as you can see some examples here, and that lockdown, and we were starting to develop some of these messages, had eased. So people maybe thought, because lockdown measures had eased, that this was COVID was no longer a problem, or people didn't really need to follow any of the advice anymore. So the idea in Nigeria was to use truth again and make sure that we highlighted that truth was the, combating this information, truth was the route to go. And after a lot of discussion with the team in Ministries of Health, there was a few different taglines and approaches to truth that we could take. And you'll see on the bottom right-hand corner that we decided to go with spread the truth, not the virus. So that was the tagline or the slogan of the overall campaign. That you'll see reflected in all of the materials. So again, this path of identifying the challenges in the country, then selecting which territory is best, and then honing how that territory would be applied happened in every country. And I'm just illustrating that with this example from Nigeria. So now that we had truth as the background, how do we work with MNC Saatchi and again the state ministries of health and the team to make sure we're reflecting the local context. So here are a few things that we took into consideration, and hopefully to most of us this seems pretty obvious, but again, as we're working quickly and we have a lot of various partners, we need to make sure that all of these considerations are taken into account. So one example, just to show you how things evolved over time, is this example of the hand washing station. So when MNC Saatchi and their creative partner first presented, this is a billboard, to the team, they had this hand washing station depicted that you'll see on the left. And the team in Nigeria, quickly reflected that this hand washing station is not really what they have in northern Nigeria, and the bucket tap was more representative. So again, small changes that then make people feel like their situation is more reflected, and this is actually reflecting the context in northern Nigeria. Similarly, you'll see where we started on the left and where we landed on the right. The idea of visualizing a fever with a thermometer did not translate, and also the picture of the smell, the nose with the X through it, and then the squiggly lines people weren't really sure what that was supposed to mean. So the visual was adapted, as you'll see, again, just to make sure that nuance was captured. And finally, another example here that I'll show you is just around the clothing. So again, you'll see the woman here on the left with a sleeveless dress, and the gentleman wearing different clothes. So we made sure we adapted to make sure the woman's head was covered and that her shoulders and sleeves were covered and everything was represented appropriately, including, traditional fabric that you may find. So small changes that make a big difference and make people more cognizant of that these materials are speaking to them. A few other things, and this gets a bit into the accessibility aspect, but I'll just touch on it briefly, is around the characters, the color palette, and the typography. And again, thank you to Andrea and Razak in Nigeria. I know everyone was really helpful and really appreciative of all the input that was given. So we wanted to make sure we were showing inclusivity in terms of all different ages, people of different socioeconomic statuses, so including the woman that had the patch on her dress as well as showing various ages, children up into adults, and making sure that males and females were represented. Here you can see how the color palette changed. Again, the contrast and those, making sure that the contrast of the colors were more accessible. So you can see how hopefully everyone would agree that the ones that we ended on with the new yellow and black and the new red are more accessible than the original ones. And then finally, just the various text that was used and again, Andrea was really helpful in showing which text was more helpful and making sure that for anyone with any dyslexia or other things that it would be very easy for them to read. So we went through different typography and made sure we selected the one that was most accessible as well. So all of that is just a very small snippet of the different kind of conversations and various calls and meetings that we had, kind of go through the back and forth to show you how the creative process worked. And then here again is just a brief snapshot of some of the final posters and billboards. So some of these are billboards, some of these are more posters, and others are these are flyers that were given to CDDs and community mobilizers. So with all of that, I'm going to hand over to Geordie to take you through a few more of examples from other countries before we get into the M&E. So I'm just gonna hop off mute for a second and then over to you, Geordie.
Thanks, Leah. And I'll just quickly show my face so that there's a face with a voice. That's sometimes nice. Again, thanks everybody for joining. Good morning for me. Good afternoon for, I imagine, most of you. As Leah and both Heather have kind of walked us through where we've gotten, I get the exciting part of showing some of the final other pieces. And I'm going to apologize in advance. I work right by a train, as you can hear. So hopefully I'll go on mute when that is happening. So the first example of one of the other executions I want to show is the Ghana TV ad. And as Leah mentioned, we had focused on children, filling the gap that the ministry had identified as targeting children. So just a reminder, Ghana's theme was play your part. And so I'm going to go on mute and let Leah hit that.
Internet is so much fun, I know. Corona is trending fast, I know. Some are scary, some are funny, others too. Fake news, then don't share. Why not go to the right place for Corona news? Spreading lies can hurt. Share the facts, not those memes. You might save a life. Save a life? Yes, save a life. You can play your part. Children like us can also play their part by sharing only the facts? Yes, spread only the facts. Play your part too.
Be the one to spread only the facts from the Ghana Health Service. Play your part. In case of any emergency on COVID-19, call 112 or 311. This is brought to you by the Ministry of Health, Ghana Health Service, and UKAID.
Thanks. So yeah, I think that was one of collectively all of our favorite ones. It's definitely out of the box, and that was on television as well as various social media elements. So the next one we were going to share is Ghana again. The next one is Benin, and Benin was again it was play your part. So this is 2 player parts in a row, but it's quite a very different sort of treatment, and I'll just let the video speak for itself.
Fais ta part contre la Covid. Sa propagation peut être stoppée. Ça dépend de toi.
Limite tes sorties, mais si c'est nécessaire, porte un max dans tout le public. Oh. La Covid peut tuer, les fausses infos aussi. Vérifie toute info avant de partager.
Le gouvernement sensibilise, les agents de santé mobilisés.
Alors que fais-tu de ton côté pour stopper cette maladie?
La COVID-19 peut être stoppée. ça dépend de toi et moi. Alors que chacun fasse sa part.
Peuple du Bénin, la COVID-19 est une réalité, mais nous pouvons arrêter sa propagation si chacun de nous fait sa part. Ceci est un message du gouvernement en collaboration avec UKAID.
So that one's definitely an earworm, and again in Benin, a lot of what was concentrated on was misinformation and really making sure that the facts were passed through, and playing your part was a big part of that. The last one that video we'll share is Burkina Faso, and this is actually one of my favorites. And Burkina Faso was was truth. It was all about the truth, and so the premise here was a famous game show. And so the idea of getting correct answers and spreading the correct information. So I'll let Burkina speak for itself as well.
Tout ce qu'il faut savoir pour remporter la victoire.
2 équipes, 4 candidats pour dire toute la vérité sur la COVID-19. Comment le virus se propage-t-il? Oui,
il ne se propage pas.
Oui,
le virus se propage au contact d'un objet ou d'une personne infectée.
Bonne réponse, équipe A. Cher peuple intègre, la COVID-19 est une réalité. Malgré nos croyances et habitudes, respectons les mesures barrières. Voilà la vérité.
Ceci est un message du ministère de la Santé du Burkina Faso en collaboration avec UKAID.
Awesome. Yeah, and if everyone can practice their French at that speed at the very end, we'd all be amazing. So yeah, I think that's just really just a snapshot of some of the mass media, but we tried to kind of pull across the wide portfolio, so you can see that it was quite an array of different types of media. Even though we were within 3 different territories, it was pretty broad in spectrum. So I'll just share a couple other interesting pieces. So this was the campaign from Sierra Leone, and one of the interesting parts of Sierra Leone is that we weren't operating in a bubble here. Obviously, we were supporting the national COVID-19 responses. So, the materials developed for Sierra Leone really fit into the existing campaign that was already happening in there. And again, the use of children and the physical prevention behaviors was a big part of that campaign. And so the next slide, and then back to Benin again. I think that was again really targeting specific trainings, and what was interesting about some of these Benin responses is that they were very, very targeted materials. So on the left, you'll see a material for traditionalists or animists, and on the right was one for Muslims and Islam, and there was also a Christian-based one. So it was very, very targeted to specific community leaders and groups of people. I think that was one of the biggest parts, is making sure that the context shown through in each set of the materials. Next slide, please. And then this is sort of the final one that we'll show you. Again, this gives sort of just a snapshot of everything that we had. Up on the top right was a billboard from Ghana. Again, that was sort of the play your part, COVID is real. And on the top left is one of the, I think, more interesting treatments. That was from Chad, and it was really building on the Chadian history of these really very, very famous cave drawings. And it was, the whole idea was the new rules, and really, love is still there despite having to have a distance, respecting a distance. And that was just a really kind of interesting treatment. So that was one of the billboards from Chad. And then on the bottom, you'll sort of see everything from on the left, sort of the very traditional. Here are the basic prevention measures to all of the different social media aspects. And some social media got quite a bit of traction. I think that was probably one of the most impactful and value for money, if you will, mechanisms. Some of the interesting things that because of the nature of social media, for example, in DRC, a lot of the campaigns got picked up by one of the most famous nightclubs in DRC, and that actually gave us so much more traction because the audience became a much broader audience because of being reposted by a number of very well-known folks. And similar to that, you'll see on the bottom right, we did use influencers. So on the bottom right was a very influential imam for one of the states in Nigeria, and similar, we had a similar approach in Sierra Leone. So that's, again, with such a short time, it's hard to give give it all, but this is sort of a broad scope. Moving on to how do you measure this? And those of all of you who have worked in various programs know that measuring behavioral changes is quite difficult, and particularly in limitations of a pandemic and also a very, very quick time span, right? This was over the course of about 6 months. So we had sort of a triad approach to measurement, if you will. And so if you pop over to the next slide, Leah. And so the three elements that we had as part of our measuring approach were monitoring of campaign reach. And this was part of working with our mass media partner and marketing agency, MNC Saatchi. Also, they had a black to buy all of the media spots across all of the countries, which really fast-tracked that. And with any mass media, TV and radio, those we know approximately the amount of reach and the number of people that we'd reach. So that's sort of just a basic monitoring of mass media campaign reach. And then the second two pieces involved a third-party organization called Geopol, who often does omnibus style surveys, and this was a sort of a quantitative survey and it was a telephone-based survey to get direct feedback. There were a number of limitations to this, but it was really, I think, a really interesting way and a method that I think we will likely adopt for other behavior change and mass media approaches. So the idea was we had a sample size of roughly 300 people in each of the countries, and then it was a self-selected panel that would then be given a telephone interview, and we'll play the various spots and ask questions about those spots. And then the final piece was because of the limitations of a telephone interview, specifically for people with disabilities, we did a very targeted survey specifically for folks with disabilities in both Ghana and Nigeria. And I'll talk a little bit about that more next. So just to give you an idea of what we measured across the scope is, the outputs are basically just that, the campaign assets that we designed. So the TV, the radio, the billboards, the posters, then the project figures. So that's just basically the awareness, the outputs, the number of people reached that we had talked about. And then, so the awareness is, how many people, part of the Geopol survey was, how many people are hearing or seeing specific ads during the campaign duration. Again, that was one of the other limitations, is that the campaigns aired for varying amounts of time. Although we started in August and ended in December, not all countries had the same amount of airtime. The next piece was engagement, and again, that was a bit more really kind of understanding the more nuanced pieces of how the mass media and the campaign affected people's personal lives or their communities, and getting a bit more of the qualitative pieces. And finally, the impact. How well did we measure? How well did that change actually happen? And that was through social media or through the Geopol. And then the next piece was again making sure that we were able to reach as many people as possible, but also have as many people be able to participate in a meaningful way. And so that's where the Geopol and inclusion piece came in, is making sure that we had adapted these phone surveys so that they could be given in person or in small groups, and that varied from country to country. So, and I apologize, Leah, there's a couple of animations here. Yes, so this is a lot of slides here, and my circles have moved. But basically, just the snapshot is that the Geopol results was just under 3,000 respondents, and it was done in 11 languages. So, I mean, this was a pretty huge effort to have done in basically the span of about a month for each of those countries. And just a few highlights for the results of attribution from that. So I think one of the big highlights from that was there was a really, really high campaign headline recognition. So in the surveys, people are asked if they'd heard of the headline campaign, and so you'll see that the very lowest one was in DRC, and then the rest sort of spanned all the way up to about 92% in Ghana. So there was a really, really high recognition of this specific campaign. The second piece was message retention, and this is again how well did people remember the message that had been transmitted. And what's interesting about this is that it's really the messages that were most remembered across all of the countries were very much the physical prevention measures. Wear a mask, wash your hands, and stay physically distant, which in this case were absolutely the most important. And then the third piece was that there was a clear campaign messenger. One of the questions in the GeoPoll campaign was, who was this message from? And it was very, very clear that in each of the countries, depending on how it was framed, that it was from either the UK aid or their respective government. Interestingly enough, oftentimes in some countries, one of the findings was that many folks trusted messages that were from a large international organization versus the government, which as an American is probably not shocking. Next slide. And again, as I mentioned before, there was a campaign recognition. So we wanted to know how well could we sort of say people are recognizing our campaign. There is a certain amount of bias involved because again, we're not operating in a bubble. There were other COVID messages happening. So what you're seeing here is the recognition of the campaign UK aid logo and the period of time that particular campaign was going on. So it ranges everywhere from sort of 94% of people surveyed really recognized that it was a UK aid, to the lowest amount was in Burkina Faso. But interestingly enough, also you'll see in Burkina Faso was live for almost 40 days, yet still it was a lower recognition of UK aid logo. And then the next piece is resonance. How well did this resonate with people? So the questions like, did this message, does this campaign speak to you? And again, without the lowest set of responses for that was the portion was 91% of people in Ghana, all the way up to 99%. So clearly, I think that the territories or themes that we had chosen with governments were very resonant. And then I would say across the board, the majority said that they found the campaign easy to understand, and that one of the questions was, would you share this message with others? And the answer was overwhelmingly yes. Next slide, please. And again, this is a little bit hard to read this slide, but basically what you're looking at is the dark blue pieces on the left is the number of people that said that they would change their behavior after having seen it, and then the lighter kind of teal color is that they had heard it and understood it and had thought about the intention to change their behavior. And what we want is obviously the dark blue is that because I've heard this, I've changed my behavior. And overwhelmingly, I think that this was a huge success in any behavior change campaign. If small percentage points mean quite a bit in this specific metric, and we had 86% in several countries, with the lowest being in Nigeria at 56%. But again, this is huge, really high levels of attribution. And then the last sort of piece was sort of adherence to the message. All right, that in response to the audio, so people were played the audio clips of the various messages that were played in different countries, and asked, would you follow this advice? And the answer to that was overwhelmingly yes. Again, the lowest was in Burkina Faso and the highest in Sierra Leone at 95. So everything else was in between those two. But I will say that it was really, most of them were in the 90s. And then the other big piece that I think was very important to us was the levels of trust that, again, back to Leah's comment of having a trusted messenger. So, that it was very, very high. The lowest is 93% all the way up to 100% in Nigeria. So I think that speaks volumes to the success of the campaign. So just maybe you can just click through all of those, but I think that some other pieces that came out of not only just the GeoPoll findings, but just the sort of monitoring and the overall insights from that GeoPoll exercise were that the strong campaign headlines were much more likely to be recognized. If it had a really snappy one-liner, that was what was most likely to be recognized. We talked already about the idea of directive physical behavior messages were the most recalled. Wear a mask, stay 6 feet apart. Again, using local language and video had a huge effect on local residents. They were all tailored to, from the children's campaign in Ghana to that song that we played for Benin. Again, longer campaign time, the more exposure, if you will, the more dose response you can get, the better. The more times people hear the same message, the more it's trusted, and the more they will change the behavior. And I think that the other big output of this is the impact of social media was massive. And then the final piece was, I think, interesting working with other marketing agencies who hadn't, with an organization like ours, that accessibility of materials was a huge piece. And I think that was a positive thing, is I think that we've maybe influenced the way some organizations, both MNC Saatchi and Geopol, will perhaps work in the future. So I'm going to stop there. I know that was quite a bit, and I'm going to hand off to Heather quickly.
Thanks, Geordie. So yeah, I'll just do a very quick roundup of our monitoring that wasn't done through the Geopol phone surveys. So where in-person monitoring visits were appropriate, obviously COVID-19 mitigation methods were top priority to ensure that our activities didn't contribute to the spread of the virus. So an example is in Liberia. The staff who attended and conducted the training of trainers remained in the areas for 10 to 12 days after the training in order to monitor their activities. So they met up with the supervisors and provided feedback directly to the community health workers and volunteers, working together kind of on a daily basis to discuss issues they'd find and to think of ways forward. So a really kind of quick way to problem solve. And then where possible, supervision was either kept local and reports were submitted to national teams through online platforms. So in Benin, a WhatsApp group was created, and that was used to collate information and pictures remotely of all of the various activities that were going on. Nigeria also used existing mHealth systems to implement our monitoring activities. So the ComCare app, which is often used on our general NTD interventions, prompted the coordination team to follow up with specific issues that had been identified by local supervisors. So it meant that if a supervisor flagged an issue, it could be tackled in near real time because it was done through a mobile network. There are, however, still some problems relying on mHealth solutions in rural areas. For instance, some supervisors had issues synchronizing their devices, which raised a red flag in that a community hadn't been supervised, but it only took a phone call to work out that actually it was just a data syncing issue. So overall, the misunderstandings were quickly resolved. And mHealth platforms were also used in DRC in a similar way. And again, there are some issues with internet connections, but in the end, we did receive all reports from the 34 supervision visits that took place. And working with our consortium partners, the Liverpool School of Tropical Medicine, who have an office in DRC, their staff also helped maintain regular calls throughout the campaigns with the various heads of division of all of the provinces to make sure that we're on track. All right, so I think we don't have too long left. So we had just a very quick slide about some insights and reflections. And I don't know what the other guys think. We were just going to maybe give an example of something that resonated with us kind of personally to take through, but I don't know if we want to just head straight into questions instead. I'll leave that up to Leah and Geordie.
Yeah, I think maybe, Heather, I think we could probably head into questions. I guess the main takeaway on this is that, when trying to think about the insights that we had, obviously we can write a lot of statements that, teamwork is key and a lot of things that we all know. I think this was a unique situation given a lot of these words you see on the left, including urgency and pressure and changing things, but that we've learned a ton and how the network that we have is Sightsavers and as NTD programs were absolutely instrumental in pivoting and providing this work. And there is some learning reflections and different papers that we've published on all of this, but we could probably talk about all of our insights for quite a bit of time. So it may be best to head over to questions. And then I think, hopefully I'm not speaking on behalf of Heather and Geordie and Bex, but we'd be happy to talk about any of this further if people were interested to know more.
Yeah, we could probably talk your ear off, but I think that list of words on the left is very much, I think highlighting humor and agility. I mean, it was sort of like watching an amoeba grow. It really required quite a bit of all of these different things. So, yeah.
Great.
So yeah, please, happy to take questions. I know we've got maybe 10 minutes, 11 minutes left.
Yeah, thanks, Geordie. So there's a few that have already been placed in the chat box, and I know some of them been answered, but one that remains is how crowded was the bandwidth? Were others putting out these messages, or did we need to coordinate with others who were putting out similar messages?
I'll go ahead and I'll start and let others jump in. I mean, I think that's a really, really good question. I think that was one of our primary concerns from the very, very beginning of making sure that we weren't, creating more noise in the space, that we were actually filling a gap. So absolutely, that was one of the big parts of all of this back and forth was making sure that we weren't making the space more crowded, that we were actually filling those gaps. So, the Sierra Leone example is a really good one where we really were trying to fill in specifically what did they need from us with this funding, was to fill that gap. So as much as possible, we were trying not to compete with other messaging, but rather complement them.
And maybe just to add on that, Geordie, MNC Saatchi had a media partner called Simply Black who was responsible for all the purchasing of the different spots, and they worked with local media agencies in country, so they were very much aware of the existing media landscape and had that media buying expertise. So that was all. It wasn't, like one of us calling up and saying, this spot looks good. It was done by professionals who do this as part of their job and with local media agencies in every country. So of course there were a lot of messages around COVID going out there, but I know, I believe David in Ghana kind of shared with us that the Ministry of Health in Ghana said that these were some of their favorite materials that were developed, and by trying to identify gaps from the beginning, such as, a focus on kids or having materials be more accessible, we tried to, like Geordie said, kind of fill those gaps and have a value add in all of the materials that we developed.
Great. I guess one that's a bit similar to that question, or could be expanded on a bit more, was, did you consider linking up with other campaigns on this topic, like the UN Verified campaign, which was about misinformation about COVID-19?
I think, yeah, I mean, we definitely, we considered all of those things. In fact, early on, we had actually sort of linked with Leah and I's former employer, Johns Hopkins, who were doing a number of messaging. And I think that basically our response was very much responding to the country's needs. So if the country said that, it would be best to feed into, the UN piece, we did. But for the most part, we were very, very responsive to national sort of COVID-19 task forces and what they felt they needed.
Yeah, and just to add to that point, as an example, in Chad, we actually worked through the Chadian Red Cross because that's who the Ministry of Health identified as kind of being their main COVID response partner. So we included their branding on it to make sure it was kind of trusted and accepted in the country.
Thanks, both. There's a comment saying fantastic ads, and then a question, is it possible to have a little more detail on the rationale behind the different approaches in different countries?
I'm wondering if by different approaches you mean the different themes that were selected, or different approaches in terms of the various communication channels. We do have kind of like a snapshot document that provides a little summary of why each theme was chosen with each country. And in some cases, multiple themes were presented to the country. And like in Nigeria, for example, both truth and protection were presented to the Nigeria team and ministry and asked which theme resonated most with them, because the challenges that we were seeing in Nigeria fit both of them. But there was a lot of background work, questions collected, conversations had with the teams. And then based on that, a theme was, one of the territories was proposed to the country for them to either say, yes, this makes sense, or this doesn't. But having that, you know, as I highlighted, the kind of overarching theme with the key messages. So also in Liberia, for example, they wanted radio spots to specifically cover certain messages, so those fit into certain themes as well. So it really did vary on country. We could share that, I think it's called the snapshot document, that gives a little paragraph as to why each theme was selected in each country. And as you can imagine, I'm sure in some countries, one theme really stood out. But like I said, in other countries, such as Nigeria, there were options, and it was just more what resonated most with the ministries and the teams.
Thanks, Leah. So there was a question about if we can share the videos around so people can watch them again. Definitely. I know Kate McCoy put a link for the iVillage where they're saved on iVillage. We also have a few on a YouTube playlist that I can send around when I share the recording. Another question was, can we get English translations for the videos?
I don't know if we have them.
No, yeah.
I'm not sure we do. We could probably approximate some English translations. But if there's a specific one, I think any of us that worked on it would be happy to help translate. At least for a French one, I could help. With any of the other languages, I'd be dismal. But
Great.
There's also a story map. I was just thinking, Alyssa, maybe that can be shared.
I'll share that as well. Definitely, that's a great story. Gives in more detail about the behind the scenes as well. Right, I mean, we have 5 minutes. Does anyone else have a question? Probably have time for one more.
I'll share an interesting anecdote while maybe there's someone chats one in. Just recently, these materials and the story map was shared with the Louisiana State Board of Public Health in response to a number of folks sort of saying that the Louisiana response to COVID had been really dry and inadequate. And so some of these materials had made it to the Louisiana State Board of Public Health in a meeting, which was pretty cool. So
that's very cool. So strange. Right. Couple questions just came in. One is, what did the other Ascend program do? So Ascend, what is it, Southeast Asia and East Africa, and which is run by Crown Agents. And then Geordie, a question for you. Would you and the team be open to us using the learning for our approach to in-country comms?
100%, yes. I think we would love to take a lot of, I'm hoping that this work maybe will change a lot of the way that we do work in countries.
And maybe to build on that, we are doing a pause and reflect session, I believe next week, the 11th of March, whenever that is, with the Ascend Consortium to reflect on how the COVID response went and what are some of the lessons we can take into our general NTD behavior change work. So Natasha, we can also share that with you. I know that's a slightly different lens than in-country comms, but just kind of trying to carve out that time to actually think about what went well and what countries liked. I know Nigeria already had a talk that they presented, kind of some reflections they had and things that they liked, such as influencers, etc. So we'd be happy to share more from that pause and reflect session when it happens as well.
And to answer the other Ascend part, I'm gonna defer to Leah and Heather on this one because I have to say I don't totally know. I know that some stuff happened, but I'm not sure that I know enough to speak intelligently about it.
No, I don't know. I think we were so focused on getting this done, blinkers went on.
I do know that the third party monitoring did like a joint evaluation of the COVID work, and they provided a report on the activities of the other Ascend lot, and they didn't do anything quite as like this massive communication campaign. I think they did a few other things pivoting, and we can probably, I don't know if that report's shareable, but they took a different approach, and I would say a much smaller scale, not that we're biased or anything, but a much smaller scale in terms of what they did, and more kind of NTD focused than really pivoting completely to COVID that like we did. But I don't have enough details, I'm sorry, to give you more than that.
Right. Well, we're just coming up to one here in the UK. So if you have any questions, if there's any remaining questions, I'm sure I'm speaking on behalf of the presenters, but I'm sure if you would like to send them the questions, they can answer them as best as they can. And really just a big thank you to Leah, Heather, and Geordie for joining us this afternoon and sharing your insights and the lessons learned from the Ascend COVID-19 response. It's been really, really informative and great. And like they said in their presentation, there will be another lunchtime talk coming up on, I believe it's the 24th of March, which I'll be sending an invite out to very shortly, around the inclusion aspect of the messaging and social behavior change communications that were part of this campaign.
Thanks, everybody.
Thanks, everyone. Have a nice day.
Yep, thank you.
Bye.